And we're at our Croakey Go Navigating Health in Melbourne, and we've dropped into Drummond Street to the services here, and also co-located is the Lowitja Institute, Australia's National Institute for Aboriginal and Torres Strait Islander Research. And I have Josh here. Josh, could you introduce yourself?
Thanks, Murray. So, hi everyone, I'm Josh Power. I'm a juryman from far north Queensland. For those who know the Bowen region, that's where my people and land is. But obviously down in Melbourne, been here for 2 years now. I was meant to be born down here. I love the cold, so this is, my community as well now.
Today.
Yeah, definitely.
And can you talk to us about the work that you're involved in, the work that Lowitja does, specifically around mental health?
No, definitely. So the Lowitja Institute takes a full person and community approach to the health. Some of the projects that we funded look at the social and cultural determinants of health. For example, one of the projects was the
We've got it here. Shall we look?
Yes.
Let's go and have a look at it.
So this one here was the Victorian-based study, which looked at the health impacts on racism. So we talked to out of all the participants that they interviewed, 1 out of 8 had experienced some form of racism more than once, and that's over a 12-month period. And then 97% of those participants who we interviewed, they had experienced at least racism at one point in their life. Racism there's no spectrum of how good or bad racism is. Racism is racism. Wrong is wrong. So we need to take this wider approach to looking at racism and looking at some of the tools and resources that we're implementing to overcome racism, make it aware.
And it's that interaction of racism with health, isn't it? And I think your report identified racism happening in the health system, but also the impacts then on people's health of racism. It's not just a standalone
definitely.
thing.
And mental health is, it's becoming more commonly known that mental health affects your physical well-being. So, and if you're looking at those numbers, 1 to 8 in a small minority community, that's extremely concerning high amount of people who are experiencing racism.
Yeah. And another project that you've been working on?
Yeah, so the healing the past, nurturing and nurturing our future. So that one looked at it developed some resources for young parents with new babies and those parents who had experienced early trauma in their life. So it looked at some of those. So it developed those resources, but it also looked at ease of access to those resources. So, what are the best ways those people experiencing that trauma can access? So, through Aboriginal medical services or, perinatal care services.
And a big thing about Lowitja Institute is that you look at, one, it's Aboriginal-led, Aboriginal and Torres Strait Islander-led.
Yep.
It's research that connects very closely with community. What are the messages that you give to non-Indigenous health services about the sorts of research that...
We don't go,
No. That was hopeless of me to actually not do anything. That was the bystander crime. In terms of research for non-Indigenous organisations?
Yeah, so, our research is 67% of our researchers are, the chief investigators are Indigenous. So it's, it's owning our own space. It's led by our own people, and the priorities come from our own people. So that, that engagement and the effects, the impact it has towards the benefit of our people, is evidential through, having those Aboriginal and Torres Strait Islander people throughout the research, who are being researched as well. So it's also looking at owning our own data in that space as well.
And I want to just put in a little personal plug.
Yes.
That you just recently hosted the national conference.
Yes, we did.
In Darwin, which was just an amazing thing. What would be your takeaways from it? And I say this that Croakey covered the conference, so people can go to our site and read a lot about it. But what were some of your takeaways from that? Or did you not have time to even notice as one of the main organisers?
I was a bit all over the place, as the event organizer for that conference. But I did get to, experience some of the presentations. What I took out of it is that it's this message, this through-line message that was coming from all of our presenters and on an international level as well, where, there's the focus is on those. We want to look at those solutions, and those solutions that we have, and those knowledges we've had for over 60, 70,000 years. We can use them now in the space that we've been put in post-colonisation for global change. And in a lot of those areas too, you look at some of those, some of those organisations that are already working in this space and have been for years, and seeing how, for example, the Aboriginal Medical Services, we're world leaders in that space. We have this amazing holistic care and approach to our health, and we own that. So we're very proud of that, and that was, a key message that came out as well. So I think everyone's doing a really great job, and Waima was like, we're world leaders in this space, and it's something to be really proud of. Yeah.
Fantastic.
In our own space, I should say.
Fantastic. Thank you very much.